My name is Matt Sweeney. I am in charge of the Newark Strong project at Newark Beth Israel, and with me today is John Langdon, who is my counterpart, and he is in charge of the Cancer Institute project in New Brunswick. 2020 was a slow year for us as construction was not at a standstill, but it had slowed down. So for 2021, we did want to focus on these two projects as they are major milestone projects for the healthcare system. And I'm hoping most of you have heard of at least one of these. So for the Newark Strong project, we've partnered with Turner Construction. And for the Cancer Institute project, we've partnered with Jingoli along with Devco and Driscoll, and John can speak a little bit more to that relationship. Through our partnership with our construction managers, we've had a focus on what we term UBEs, underutilized businesses, which is inclusive of minority, woman-owned, veteran, and small business enterprises. So when we subcontract out work, we're looking to hit targets and dollar values for those different enterprises. In Newark, we have a Newark First Source hiring initiative where we're trying to engage Newark businesses. John is looking at kind of the New Brunswick, greater New Brunswick area. So he's tracking that as local, whereas I'm tracking Newark as local. John's group also has a train to hire program, which I believe Dr. Alexander kind of alluded to when he spoke. I'll probably speak to that a bit more. Turner is a part of the ACE mentorship program, and I was actually a guest speaker at their awards ceremony in June, along with the DOT commissioner, which was very, very exciting to just speak to the younger generation. And for those that don't know, ACE is an acronym for Architecture, Construction, and Engineering. So students looking to get into that field. And then both projects also offer summer internship programs through our CMs. So as I mentioned, 2021 was an exciting year as we've gotten both projects out of the ground. I'll speak a little bit more to Newark, but I'm going to turn it over right now to John, who can speak to the Cancer Institute and what's been going on over there.
All right, thanks, Matt, and everyone. So the Cancer Institute, it's a $750 million project. There's about 435 of that is direct construction costs. So we're looking to spend that, with a high amount of minority and women participation. We also want to promote workforce goals for local as well as NWBE. In 2020, we did early procurement of mostly the core and shell of the project. There are large contracts, but each of the major subcontractor has identified contract participation within their subcontracts, and that could be, subbing out part of their work to a participating subcontractor. In next year, though, we will be doing the bulk of the procurement, and we're talking with Jingoli and Driscoll about how we maximize our participation, identifying set-asides and carve-outs within all the different bid packages to maximize that participation. On the workforce side, we're trying to, doing that in a number of ways. One is we've signed a project labor agreement, whereas the trade unions support our efforts for local minority and women hires for this project. And again, as Dr. Alexander mentioned, we supported Jingoli and Apex Solutions in their program, their train to hire program. And that brings adults back into the workforce. And many of the first graduates, which was over the past summer, are now employed either at the CINJ project or a project that we're supporting at the New Brunswick Jersey Avenue School. In addition to that, through Jingoli, we're supporting two other programs with the Youth Advocate Program and the New Brunswick PTech. But that introduces high school age students to STEM and engineering and construction trades. So we're happy with what's happening so far, and we look forward to next year and meeting our goals. Thanks.
Thanks, John. So what we did is we looked at our current commitments. So John mentioned, on his job, he's bought out the core and shell work. On my project, it's not as big. We've bought out most of the subcontracted work. I think the exception is there's still a cath lab expansion project coming up next year, or 2023, so we'll be buying that out using these same initiatives. We also have a ICU project next year that we'll be buying out. So to date, there's been $172 million of subcontracted work, and of that, you can see the highlights. Almost 21 million has gone to minority businesses, 20.5 million to women-owned businesses, just under 3 million to veteran, 15 million to small. Again, local. John's looking at local as Greater New Brunswick area. I'm looking at local as Greater Newark area. There's been 41 million committed to those. And I know Barry likes to see how much money we're keeping in the state of New Jersey. So almost 88 million has stayed within the state. Jingoli is based out of New Jersey. While Turner is headquartered in New York, their Somerset office is performing all the work. So all of the Turner staff are New Jersey residents. And then I've listed some kind of major partners. Well, I'll focus on Josloff because that's one that I'm very familiar with. They're one of mine. Josloff is a woman-owned Newark-based business. They have a nearly $6 million glass contract on the Newark Strong project. So when we get to the rendering and you see all that pretty glass, there's a Newark-based woman-owned business that's doing that. And actually, all the glass is sitting in their yard not far from here, getting ready to be installed in January. So next slide, please. Also, as John mentioned, is the workforce participation. Who's building the project? Forget the contracts, the workforce on site building it. So we have projected hours for the total amount of work that's been awarded, and you can see the breakdowns. And we're, again, focusing on the similar categories. John and I differ. He's looking at more Middlesex. I'm looking at Essex. But this is the workforce building the job. These are the people on site. If you go out to the job site, you can find someone that's a Newark resident or someone that's minority or a woman. I know we have a female plumber that's here. She's getting to know the facility very well. And then also looking at New Jersey participation. How much of the work is being built by New Jersey residents? So next slide. So as I mentioned, I'll conclude with this slide, the Newark Strong project. All the glass you're seeing is coming from a Newark-based business. This is well underway. We have steel up. I believe the last time Barry was out here, we were still excavating, but the steel is up now. I don't know if John will want me to do this, but you guys, whoever's interested, is more than welcome to come out and take a tour of my site, his site. We also have camera links where you can see real-time progress of what's going on. We look forward to the next 2 years. I think John's project might be a little longer. Provide updates on how we're spending the dollars, how we're doing on tracking the labor rates and the commitments from the labor unions. Also, as we buy out more projects, we'll update the dollar values that are being spent and how they're being spent on our UBE businesses. So thank you everyone for your time, and John and I are available if anyone has questions.